Okay, good afternoon. Thank you all for making time on a Monday afternoon to talk about CJTA fiscal reporting. Sorry about the last minute change in virtual venue. I wanted to be able to record this presentation to share with individuals that were unable to attend in person, or in I guess, in person quotation marks, as none of us are technically in person. So thank you, and hope everyone is doing well today. Let me go ahead and get started. Quick introduction. My name is Tony Walton. I'm the Criminal Justice Behavioral Health Administrator for the Washington State Healthcare Authority, Division of Behavioral Health and Recovery. And it is my honor to administer the Criminal Justice Treatment Account, which is a biannual appropriation that is administered through the counties and the administrative service organizations in Washington State. Today, we're going to be talking about the fiscal reporting aspect of CJTA and hopefully providing some additional context and clarity regarding the revenue and expenditure reports, which are to be submitted on a quarterly basis by the counties that receive funding. I have presented on the screen just a quick reminder regarding GoToWebinar. It's actually been a while since I've used GoToWebinar. But in case, if you are participating by phone and you want to be able to ask a question, make sure and enter your unique audio PIN. And don't forget to unmute your computer speakers. And then towards the end of the presentation, I will allow everyone the opportunity to raise your hand, and then I can unmute you and you can ask questions either live or you can type them into the chat box. Oops. And just a reminder, basic GoToWebinar controls. You have the little orange arrow, which is the grab tab that allows you to minimize and maximize your little control panel pane, and you can move it to different screens. And then it also has the audio pane, which you can use to switch between computer audio and phone call. And then the hand icon, which will be helpful in the future. You know what? I wonder if okay. Nope, never mind. I thought maybe that was just dismantled from this current version, but you all should see that. If you don't, please chat in the box. And then the questions pane, and then the chat function. Feel free to use either or. I think that the chat is a little easier and not as confusing, but I believe the questions is equally available in terms of asking questions during the presentation. As a reminder, if you see a little green arrow on your hand, that means your hand is currently down. And by clicking on the little hand with the green arrow, that is raising your hand. And then it'll switch to the icon below, which is the hand with the red arrow. That means your hand is currently up. And by clicking that again, it will lower your hand. Okay. So I organized this time to discuss the reporting of revenue and expenditures under this criminal justice treatment account, specifically the submission of the revenue and expenditure reports, which account for the how the funding is being used on a quarterly basis by the counties. We have gone through numerous versions of the R&E. And I think the most recent one, which is just specific to state fiscal year 21, was a little more complicated, and I wanted to provide some, just go through each one of the elements step by step, and then hopefully provide some additional clarity. I'm going to go ahead and switch from the PowerPoint over to the revenue and expenditure report. This is the format that everyone receives the R&E in. And you'll essentially just be starting with row 2 by selecting which county you are reporting on behalf of or from. And that has the various counties that contract with the healthcare authority. I'm going to pick Thurston. And then you'll identify the reporting quarter. So the quarter in which the expenditures took place, which currently should be the October to December of 2020. As a reminder, those are due February 15th. All of the quarterly progress report, programmatic treatment report, and the revenue and expenditure report are all due 45 days after the end of a state fiscal quarter. State fiscal quarter 2 ended December 31st, 2020. So those reports are due on February 15th of 2021. Zoom in here a little bit. What's new? What's new with this version of the revenue and expenditure report is the addition of one more line under revenues, and that is the CJTA Therapeutic Drug Core. And what that is funding that was allocated for state fiscal year 21 out of the legislative bill in gross substitute Senate Bill 6168. That appropriated an additional $4.5 million for specifically for therapeutic court enhancement or expansion. The other two revenues, the underlined row 7, the criminal justice treatment account is referred to as the base funding. The state drug court is included for 9 counties that receive additional funding through the state drug court, which was a different proviso in the past. And then all counties did receive the CJTA Therapeutic Drug Core, also known as the supplemental appropriation or the in-gross substitute Senate Bill 6168. So for example, for the October to December 2020, for purposes of reporting on the revenue and expenditure report, you would indicate how much of that funding, and this is all included in the contracts, how much of that funding was base CJTA. So just using purely fictional numbers here, we'll say 10,000 was base CJTA, 20,000 was funding from the state drug court, and then for this particular region, we'll say 9,000 was, oh, not 90,000, 9,000 was from the in gross substitute Senate Bill 6168 Therapeutic Drug Court. So that gives us in total $39,000 in total revenue for this quarter. Then when you switch down to the expenditures, and this is this aligns with previous direction regarding the revenue and expenditure report, you're going to indicate of that $39,000 that was received for that quarter, how much of it was spent and on what services. So let's say, for example, for this kind of trial example, we'll say that 10,000 was spent on assessments. We'll say 15,000 was spent on IOP, 5,000 was spent on case management, 8,000 was spent on, oh no, let's change that, say 4,000 was spent on urinalysis, and then the administration, 3,900 was spent on administration, which has a 10% maximum. So you'll see for those expenditures, our revenue of 39,000, of that 39,000, 37,900 was spent. What's new with this version of the R&D is breaking down those expenditures by how much of that 37,900 was from the base CJTA funding, was from the CJTA state drug court funding, and was from the CJTA Therapeutic Drug Court supplemental appropriation through ESSB 6168. So then what that requires the county to do is to identify, of the $10,000 in assessments, how many of those assessments went to therapeutic court participants? Of the 15,000 of IOP treatment, how much of that 15,000 went to a therapeutic court participant? and so on and so forth. If in your county, your local panel has decided that all of the funding goes to therapeutic courts, then this is a really easy reporting mechanism, because you're just you can break it up accordingly, either proportionately. So you could say, what, it's less 39,000, so 10,000 of one, 20,000 of another. And then what was the, oh, and then 7,900 from their supplemental appropriation. And so then what this tells the healthcare authority is, of the 37,900 in expenditures, the pots of money that are being used to pay for those expenditures are broken down as such. Let me turn that off. I apologize. And what you want to see at the end is a discrepancy of 0. And then what that allows is to just note that there is no discrepancy between the total expenditures reported and then the broken down funding source for each of those expenditures. Where this might get a little more tricky or complicated is when a county or region is using the funding, some for therapeutic court participants, some in jail, and some for IOP treatment for individuals that are not on Medicaid. And Stacy, I know she asked a question. I'll go ahead and just refrain from going through those, and I'll go to all the questions at the end just to kind of keep the flow of the meeting going. But feel free to continue to ask questions either in the chat or the question box. So then what that would require is just basically working with your contractor or subcontractor to separate out therapeutic court participants from other participants that might be receiving CJTA funded services. I would say if all the funding is going to a therapeutic drug court, then you could also just use one pot of money from the beginning and deplete that. So, and I guess that would be more applicable if you didn't spend the entire quarterly revenue, but instead only spent. So the same example, let's say that there were no assessments, there were no IOP, there was case management and urinalysis, and then just to make it easy, just case management, urinalysis. I would suggest prioritizing spending down the supplemental appropriation, the therapeutic drug court, before the CJTA and state drug court, just because there's more flexibility regarding those other funds, whereas the therapeutic drug court can only be used for therapeutic drug court participants. So then what this would look like is you would have none from CJTA, none from state drug court, and then 9,000 from the therapeutic drug court. And then the next month, if the expenditures are more, then you can start with pooling from the therapeutic drug court funding source and then move on to the CJTA and state drug court. And just keep in mind, not every county receives the state drug court CJTA. It's only 9 counties out of the 39 counties in the state of Washington. For those counties that do receive the state drug court CJTA, you're going to treat it as if it is base CJTA funding. It's not as specific as the therapeutic drug court proviso that was in the operating budget bill last year. So finally, what we have now is, of those $9,000 expenditures, we break them down by population. So if you are only using CJTA for an adult drug court population, then it's pretty, well, I guess not necessarily, because of that adult drug court population, there could be pregnant and parenting individuals within it, but you would just have to break it down. So if no pregnant and parenting individuals were served, then it would just be 9,000 of the total expenditures went to adults. That matches up here, and there's no discrepancy. Or let's say that 500 of the case management was provided to a pregnant and parenting individual, then you would have it broken down like this. And so the goal on the revenue expenditure report, and then keep in mind also that you can use the comments function to kind of capture anything you want to point out regarding any of the allowable expenditures underneath the funding. But the goal here is to make sure that you have a discrepancy noted and that you're accounting for the various expenditures by fund source and by population. I'm going to jump over to another new element of this version of the R&D, which is the certification sheet. So as you'll see down towards the bottom of the report, you'll have 3 tabs. The first tab is the R&E, the second tab is certification, and the third is a data sheet where the drop-down boxes are created. So you don't need to deal with sheet 1. But certification is something new that needs to be included, and this will be included going forward with all of the revenue and expenditure reports submitted. The process is very similar in that the name of the county is included within a drop-down option. The reporting period is as well. And then we've actually pulled over the data submitted from the R&D report on row 33. So we know now what this is the county certifying that there were $9,000 in total expenditures for this reporting period. And then the next tab or the next cell is the 30% innovative special project requirement. As a reminder, the contract calls out that 30% of the funding that's allocated needs to be used for what's called an innovative or special project. And this is where the county would certify that we met that requirement through this amount of dollars. So I mean, if it's 9,000, then you would have, I think my math is right there, 300, yeah. So 300, is that right? No, that's not right. Math is wrong. 3,000, there we go. And that might still be wrong. It's somewhere around there, but I apologize. I'm a social scientist, not a mathematician. And so there is where the county would be certifying that they met that 30% innovative requirement. Keep in mind that the innovative requirement is per contract cycle, so for the entire fiscal year. So it is possible that you might be submitting some revenue and expenditure reports where this would be noted as a 0. Like let's say it was the beginning of a contract period, you had new contractors, and there was no innovative projects during that time. What we're looking for is at the conclusion of a state fiscal year that at least 30% of the allocations went to an innovative project. So this could be lower or number than the actual, well, it wouldn't be higher than the actual expenditures, but it might be a higher percentage. So in another quarter, it could be actually, 20,000 was the number of expenditures, and almost like 50% of that met the 30% innovative project requirement. And then at the end of the fiscal year, we would just aggregate those data and identify if that requirement was met through the 30% innovative. The next cell is regarding the match requirement. So per I think it's RCW 2.30.020, any state funding that is appropriated and utilized for therapeutic courts has to be matched dollar for dollar with cash or in kind by local resources. So if in this example, the $20,000 in expenditures, if that all went to therapeutic court participants, then you would identify that the 20,000 went to therapeutic court participants here. And then you would confirm that the county made 100% cash or in-kind match by entering that number here. And so if your funding isn't all serving a therapeutic court population, this might be different. So like, let's say half of it is going to therapeutic courts and the other half is not. Then you would just account for how much of the 20,000 in total expenditures is specific to therapeutic courts, and then identifying that the county has indeed met that match requirement. Then the next piece is I have reviewed this report and certified that to the best of my knowledge, it is both complete and accurate. And then below, a place for a signature, organization, county, and a date. I've seen this piece, the signing piece has been done differently in a number of counties. Some counties just put a digital signature here in the signature box and then indicate, if it is the county submitting, they would just say Stevens County. Or sometimes the contractor for the county is completing it, and then they would just put what their organization is. So I think they actually changed their name, but regardless. And then the date that it is certified, and then, or some other counties have actually printed out this sheet, signed it with blue or black ink, and then scanned it as a PDF and sent it back to me. Either one is fine. I mean, really, you can even type the name of the individual that is certifying it into the signature box, because this signature indicates that this is indeed certifying. So whatever's easiest for you, at least that way, if you just kind of either use a digital signature or just type your name into that box, you can have it in one report as opposed to having two separate documents that you have to track. It also makes it easier just to send it back to me, and you don't have to do any scanning or anything along those lines. So that went a lot faster than I had anticipated, and I do apologize for a couple of interruptions there. I believe what happened, I think somebody was unable to get into the webinar, but luckily it has been recorded, and I will share it with who that might be after we're done. At this point, I'm going to go ahead and open it up for questions. So hold on one second. Let me see. Nope. How do I undock that guy? Oh, there it is. All right, undocking the questions. One question from Stacy is it not necessary to separate the ESSB 6168 expenditures? And yeah, it is. It is necessary to do that because we are tracking this funding separately. The reason for that is because of the specific population. So it is necessary to track it. I guess what I was trying to say is if all of your funding goes to therapeutic drug court participants or therapeutic court participants, breaking it down isn't going to be as time consuming because you can just do a proportion of the total expenditures went to CJTA and the other proportion went to therapeutic drug court. Or you, like I was saying, you can kind of pull from the therapeutic drug court revenue first and maximize that for the quarter, and then whatever is left would come out of CJTA. But we do need to track those separately. And I should have put do not disturb on my email, because now you're seeing the emails coming through. I apologize for that. Does the 100% match include the supplemental funding? Yes, it does, Renee. That's a really good question. The match requirement is for any state funding that supports therapeutic courts. So yes, and that's why on the certification it's grouped together. It's not broken down. It's just in total out of the CJTA drug court, supplemental appropriation for therapeutic courts under ESSB 6168. How much of all that funding goes to a therapeutic court participant? It's captured here, and then you indicate the match there. And Christy Brewer-Weaver has asked for example what's included as innovative. I can go back to the contract to find like specific examples of what is contractually required. I would say any current evidence-based practice, any specific or special project that's looking to target marginalized or underserved communities. as well as regional agreements that are looking to increase transitions of care or continuity of care. Those could all be innovative projects. It's supposed to be noted in your CJTA strategic plan what that innovative project is. So if it changes at any point, do let me know and you can update your CJTA plan accordingly. And just a reminder, October of 2021, the Healthcare Authority will be requiring a new updated biennial CJTA plan. I think that the addendums or the narrative addendums that were added as a result of the Supplemental Appropriation Therapeutic Drug Court ESSB 6168 will hopefully help at least start the local panel on that process. Well, hopefully some of those examples are helpful. And I see some more questions, so this is great. So, hi, Tony. For the supplemental that is being used for drug court training, like for MRT, does there need to be match for those expenditures? That is a really good question. And what I would have to look back at the statutory language, and then I'll get back to you on that. But well, actually, I can do it on another screen here. Hold on one second. Keep the questions coming while I take a look at that statute. And I misquoted the statute earlier. It's RCW 2.30.040, and it indicates that jurisdictions must match on a dollar-for-dollar basis state monies allocated for therapeutic courts. So it doesn't say treatment services for therapeutic courts, but state monies allocated for therapeutic courts. So that would include training or any other ways that that funding is used. So based on that interpretation of the statute, yeah, if it is being used for MRT, that there would have to be a match for that. Essentially, any of the state funding that's allocated that's going to therapeutic courts, therapeutic court participants, or associated training. Really good questions. And also remember, you can raise your hand if you want. Oh, here's another question in the question box. Can 6168 be relabeled therapeutic court rather than therapeutic drug court to be consistent with the budget provider? No, that's a very good point. And this language represents or reflects the language on the Administrative Service Organization R&E. We're trying to align the bifurcated system as much as possible for purposes of doing annual reporting back to the ledge. And that is the language that they chose for ASO fiscal reporting. I will add a comment to it though, and just note that it is for therapeutic courts in general, and it does not have to be used for a drug court, but can be used for any therapeutic court as long as it's for substance use disorder treatment or treatment support, recovery support services for an individual with a substance use disorder. But yeah, very good point, Carrie. I'm going to stop sharing my screen for a second and allow time for additional questions to come in. I just want to pull up, go back to the PowerPoint real quick. I'm always conscious when these are recorded to try to not show too much of the additional work I have going on, so I didn't want to scroll through a whole bunch of different pages I have opened up. But I wanted to pull up the contact information in case this meeting was forwarded to you by somebody else and you didn't have my contact information already. There it is. Please feel free to call me if anything ever comes up. And also, oh, and then there's another question. I'll get to that in 1 second. If you send me an email and you do not hear back within a week, please call me. Please give me a call at the number below or my mobile number indicated on my signature line and let me know that you've been waiting for a week, and we can just address the question at that time, or I can prioritize it. I still have around 300 emails that I'm still trying to get through since the beginning of the year. So it's definitely been a busy time. Another question that came through, any discussion in legislature of more flexibility with that supplemental funding, i.e. not restricting it to therapeutic courts? I don't know about the legislature, but I can say that the governor's budget included a full appropriation for CJTA, and it did not include that proviso language limiting it to therapeutic courts. So good news there. We'll have to see what happens with the draft or the tentative operating budget bill to see what makes it into the final budget. But the governor's proposed budget, did not have any restrictions. Stacy asked, the redistribution, supplemental, and also the recent additional funding, are these all considered ESSB 6168? That's a great question. So if there was any deallocation, reallocation with your local county as a result of the work that we did last November and December, it would note on the contract what funding source is being recouped. And if there's additional allocations, it would note which funding source the additional allocations are coming from. So all of that would be captured within the state fiscal year 21 contract, and then also the contract amendment. But it could be a combination of all of them. I know for several different counties, we pulled back the supplemental funding, the ESSB 6168, because they don't have a therapeutic court and don't have the means to establish one, and then redistributed that funding somewhere else, but then also, allocated additional base funding to meet the needs of that population. A great question from Jamie. If we have been using the original CJTA funds on the R&E, but they could have been the supplemental funds, should we amend the reports and resubmit to use those supplemental first? Jamie, if you're anticipating using the entire allocation of both base funding and the supplemental funding, I don't think that's necessary. But if you anticipate having an under expenditure, like near the end of the state fiscal year 21, then yeah, we would want to do a revised revenue and expenditure report, try to spin down the supplemental ESSB 6168. And then if we need to do any final contract amendments for this state fiscal year, we can recoup CJTA, which might be able to go to one of those counties that doesn't have a therapeutic. Great question, though. Yeah, I would say, just kind of meet with your fiscal folk, and just if you're anticipating using it all, I don't think it's as important as if if you're based on current projections and modeling, it looks like there's going to be an under expenditure. I can allow a couple more minutes for questions. Otherwise, my contact information is up, and I do have, I will be contacting whoever was trying to get in and was unable to get in, and apologize to them shortly. Oh, another question came in. Skagit's last quarter expenses exceeded revenues. We're making up for quarters that were underspent. How do you recommend that I record the expenses from each fund? So if your county had under expenditures from the first year of the biennium, the communication has been that funding, can carry over into the second year of the biennium. So if you're still, you would need to spend down the first contract year, that carryover funding, before working on the funding for this fiscal year, if that makes sense. So let's say you had $5,000 left over of CJTA for state fiscal year 20. You would want to make sure that is accounted for before starting to work on your state fiscal year 21 contract amounts. And if it's a combination of the both, well, we know that the Therapeutic Court ESSB 6168 supplemental appropriation is only for state fiscal year 21. So if you're still spending down state fiscal year 20, you're not going to indicate any expenditures under the Therapeutic Core. And Christy, feel free to follow up with me if any of that doesn't make sense, and I can try to clarify. And Carrie asks, not related to fiscal reporting, so you can save this for another day, but for the programmatic treatment report, are there any efforts to change this process? Give us a better way to report data. We still find the spreadsheet user unfriendly, easily vulnerable to security concerns, and challenging to train new contractors on. Yeah, Carrie, please send that email to me with that language in there. We will hold that off for another discussion. But it is noted, and yes, I think that the healthcare authority, I myself don't have the bandwidth to do it, but I am working with other divisions to look at how we collect CJTA data and make it more streamlined and automated. So yeah, very good question. Just if you don't mind sending me an email, I can follow up through email, and then also use that email to communicate with others in at the agency. Okay, well, I'm going to go ahead and conclude our meeting, our call, our webinar. And as a reminder, this was recorded, so all the times I stumbled will now be ingrained forever into eternity. And then also, I will send it out to everyone so you can share it when you have new staff come on that might need a little kind of background about the revenue and expenditure report. And I'll also send it out to our colleagues that were unable to make the call. But thank you all so much. Great questions. Thank you for your ongoing patience, as it seems like the entire environment around CJTA is constantly changing and we have to update and be flexible. And I appreciate your flexibility and understanding as I work through these complex systems. But thank you again so much, and I hope everyone has a wonderful day and wonderful week. And I can't believe it's already February. Take care, be well.